Hi, dear ones, and welcome. I'm Amy Rose White. Today, I am going to talk to you about the real signs of pregnancy and postpartum depression. We often lump those depression and anxiety because they tend to go hand in hand. But for today, I'm really going to focus on what depression really looks like during pregnancy or in the first year after having a baby. Because the term postpartum depression is really a misnomer. There's a reason that we call in the field these hidden illnesses around pregnancy and postpartum, because they often present in ways that people are not imagining they do, believe they do, and that unfortunately might even include your healthcare provider. So as an expert in perinatal mental health, I'm here to dispel some myths. Let's just focus on the facts, what it really is. So first of all, if you are watching this, it is probably because either you or someone you care about is likely suffering from pregnancy or postpartum depression or anxiety. So I would like you to go to the link below in the Show More section of this video to find a link that self-scores a tool, a screening tool called the Edinburgh Postnatal Depression Scale. And that scale is validated during pregnancy and the first year postpartum to pick up the potential for anxiety or depression during those time spans. There is a question on there, number 10, around if you've ever had thoughts of harming yourself. If you score anything other than 0 on that, I want you to talk to your care provider right away. If you're in imminent danger of harming yourself or someone else, I want you to call 911 immediately to get to a safe place. And you'll see some other resources in the Show More section as well. To find local resources in your area for a qualified therapist and or care provider, please see postpartum.net and click on the geo map for your state or any country in the world. We have volunteer coordinators in nearly every country in the world who can help you find qualified resources, folks that really understand perinatal mental health and will do a good job of getting you the resources and treatment that you need. So let's dive into the symptoms. What does it really look like? A lot of us have this picture in our minds of a person curled up in a ball under the blankets, unable to care for themselves or other people, including babies and other children, if they have them. And the reality is that is only true for a very small percentage of people. The vast majority of people who experience perinatal depression, and again, perinatal is conception through the first year after having a baby, regardless of gender. Those symptoms of sadness and not being able to take care of anybody are pretty rare. They will tend to maybe progress to that stage at the very kind of later stages, really severe cases, but even folks who have the most severe postpartum depressions I've ever seen tend to be highly functional in terms of getting up, getting out of bed, taking care of the kids. Why? Why does that tend to look a little different than depression during other times of the lifespan? Call it biological, call it moral, ethical responsibility, that duty, that biological drive we have to keep people alive. I really believe that birthing people are just warriors and warrioresses, and they're able to, unfortunately, sideline their own mental health to take care of what's in front of them. So here are the main symptoms that I want you to know tend to present more than what we might think of as depression, but still actually meet, usually, the clinical criteria for pregnancy or postpartum depression that requires and fortunately responds very well to medical treatment. So anger, irritability, rage. A lot of people I work with will say, I just don't feel like myself, and I'm snapping at anyone and everyone, especially my partner. Nothing they do seems to be right. I don't even know why I picked this person in the first place. Those are all signs that you could be dealing with depression. Rage that feels out of your control, that isn't how you want to show up in your relationship. Those are also very common indicators of pregnancy or postpartum depression. Anxiety, agitation, constant worry. Folks will be more bothered by anger and irritability and anxiety and insomnia than they tend to be by tons of sadness or crying, although usually sadness and hopelessness and guilt And loss of interest in things that used to bring a person joy also accompany those symptoms I've been talking about so far. And that's what lends itself to this whole diagnosis of depression. It's just not the primary features that are interrupting functioning so much as anxiety and irritability are. So that's the most important thing that I want you to know about pregnancy and postpartum depression for all birthing people, is that it likely won't look the way you think it's going to look. Your care provider cannot tell by looking at you. They have to ask detailed questions. The fact that you have some of these symptoms doesn't mean anything about your ability as a parent or the love you have for your child or children. And it's all treatable. These are understandable symptoms of dysregulation in the brain, difficulty with psychological adjustment, hormone fluctuations, etc., that can generally all be solved when you get a good treatment plan and a great treatment team on board. So if you're thinking, well, I had depression as an adolescent or in my 20s or 30s, I know what that feels like. I'm going to be able to know if I have it or not. Be careful. It might not present itself in the same way that it did before. And that doesn't mean that you don't have something that warrants some treatment. It may or may not respond to what you've used in the past. Maybe that was counseling only. Maybe that was herbs. Maybe that was a medication. Sometimes those same treatments will work now in the pregnancy postpartum window, and other times you'll need a different set of treatments that I'll be discussing in another video. The most important thing to remember is you are not alone. You are not to blame. With help, you will be well again. You will feel like yourself again. Do not settle for these symptoms. Do not tell yourself you're a terrible parent or partner for being angry and rageful or constantly anxious and having a hard time getting out of the house because you're so overwhelmed. Doesn't say anything about who you are as a person. These are not character flaws. It is a temporary medical condition. And yeah, maybe you've been kind of an anxious person your whole life, or maybe you've kind of been OCD, and I'm gonna make a different video about perinatal OCD because it is different than depression, although they can often go hand in hand. But sure, maybe you've struggled with some of those things before, and now it's on fire, and now it's interrupting your functioning, and now it's interrupting your ability to really live and love your life and enjoy this growing family that you're creating. You don't deserve to settle with those symptoms. Keep reaching out for help. So again, I highly encourage you to take the online EPDS, to report that score to your care provider, to keep taking that screening instrument every 2 to 3 weeks. See if your score is going down, down, down as you use some of the support measures that I'm going to be talking about in other videos, or the support measures that you find in treatment as you talk with various care providers. You want to see your score going down, down, down. You also can use postpartum.net not only to find a provider list of qualified therapists in your area, but also to talk to volunteers who refer you to people they know in your area, as well as peer support. That is a parent who has been there, who has gone through this and recovered. So there's all sorts of resources on there. We have online support groups just like crazy right now, because at the time of this video, we are in the middle of a pandemic. So Postpartum Support International, which is the world's largest peer support organization, has a ton daily. There is at least 1 to 3 online support, social support groups for you to join. And they reach a variety of audiences: Spanish-speaking parents, Black moms, Asian moms, gay and lesbian parents, military parents. The list goes on and on. You can find your people there to support you through this process and well into your recovery. So keep reaching out. If this is helpful, please like, share, and subscribe to my channel. Please see the resources below in the Show More section. And until next time, may you be happy. May you be well. May you be at peace. See ya.